Coming up on Medical Economics Weekly, your liability has increased with the new HIPAA rules. Google Glass has been hacked for doctors. And could house calls be the future of medicine? All of that and more coming up. You're watching Medical Economics Weekly. I'm Kevin Stout.
I'm Brandon Glenn, and this is the show where we keep you up to date on trending news about healthcare, practice management, and healthcare social media.
A couple of months ago, we published an article online about the potential uses for Google Glass in healthcare. Well, one programming team has already hacked Google Glass and created an app specifically for doctors. The app, called MedRef for Glass, allows doctors to create and find patient folders by voice, add photos and voice notes, view previous notes, and probably the most interesting feature, find patient folders by facial recognition. We could talk about how great this app will be, but we'd rather show you. Here's a clip of the video about the app. Find the link to the full video in our show notes.
And I have a new card called MedRef. With this card, I can do things like set the patient I'm working with, Jason. So now it's pulling in all the records for the Jason patient. In this case, I've already uploaded several photos and pictures using this Google Glass app earlier. The app allows you to add notes and get notes. So let's add an extra note here. Needs to be turned regularly. For example, a patient with bed sores developing.
September 23rd of this year looms as an important date for physicians. That's when physician practices must have instituted new internal policies and procedures for dealing with protected health information under sweeping new changes to the HIPAA law. For the uninitiated, HIPAA stands for the Health Insurance Portability and Accountability Act. It was passed about 15 years ago and designed to protect patients' sensitive health information. Now, the federal government has made updates to the law because electronic health records are being used so widely. For physician practices, the biggest change involves what they need to do when patient data is lost or stolen. Previously, physician practices were required to report data breaches if they involved, quote, significant risk or harm to patients. Now, that standard is much lower, and virtually any data breach must be reported to authorities. Of course, to avoid data breaches in the first place, physicians should be absolutely certain that all sensitive patient data is encrypted.
Actress Angelina Jolie recently wrote an opinion piece in the New York Times detailing her decision to have a preventative double mastectomy after finding out about an 87% risk of developing breast cancer due to a mutation in her BRCA1 gene. Jolie's doctor, Dr. Christy Funk of the Pink Lotus Breast Center, took advantage of the rising press about Jolie and blogged about the procedure. Funk took to the Pink Lotus Breast Center blog to detail the 5 stages of Jolie's treatment so that other women in similar positions could use the post as a guide in the same situation. The stages start with gathering information about BRCA genes, then surveillance plans, committing to an operation, preparing for that operation, and finally, recovery from the operation. Funk concluded her blog expressing the lack of awareness about BRCA gene mutations and urging any women who feel that they may be at risk to seek medical advice.
A report from the Commonwealth Fund finds that nearly half of all working adults were either uninsured or underinsured for at least part of the last year. Overall, the total number of uninsured people in the U.S. is about 30 million. That's about the same as it was in 2010. One bright spot from the report involves people between the ages of 19 and 25. The number of uninsured in that age group fell from 48% to 41% over the last 2 years. Much of the credit there goes to the Affordable Care Act, or Obamacare, which allows young adults to stay on their parents' health insurance until the age of 26. However, the report did note a few disturbing trends. For example, 80 million Americans either didn't go to the doctor or fill a prescription last year because of cost. And 18% of adults had been contacted by a collections agency during the prior year over unpaid medical bills.
A recently released Kantar Media study found that 31% of U.S. physicians made prescribing decisions with their smartphones this year, up from 21% last year. This increase in smartphone use for professional purposes signifies the still rising growth of mobile technologies in healthcare. The Kantar Media Sources and Interactions study, done in March, found that 74% of physicians use smartphones for professional purposes in some way. That's a 9% increase from last year. In addition to that, 38% use both a smartphone and a tablet for professional uses. Some uses in which physicians used their smartphones included referencing drug data, finding and performing clinical calculations, and making prescription decisions. Probably more surprising than any individual stat was that every single smartphone task that was tracked in the study had increased year over year. There was not a single decrease in usage from the previous year, highlighting the still increasing importance of mobile technology on healthcare.
A recent article in Medical Economics Print Edition asks whether house calls could be the future of medicine. Evidence shows that the prevalence of house calls is growing. For example, Medicare paid for nearly 4% more house calls in 2011 than it did in 2010. Part of the growth behind house calls is simply due to the country's aging baby boomer population, but the Affordable Care Act also contains some provisions that support house calls, such as accountable care organizations. So the question is, are house calls a viable option for primary care physicians? The answer is a resounding maybe. Practice management experts say house calls can work for direct primary care or cash-only practices, or for practices with a very high percentage of elderly patients.
We're used to seeing stats on the large amounts of money pharmaceutical companies are bringing in and how much they are charging for drugs, but recently we saw some charitable news in that area. Two companies that make vaccines against cervical cancer, Merck and GSK, have cut prices for the vaccines in poor countries to below $5 per dose, compared to the $130 a dose in the US. The New York Times article highlighting the price reduction notes that Pap tests reduce fatal cervical cancers in rich countries like ours, but over 250,000 women in poorer countries die each year due to cervical cancer. Hopefully, this reduction in price for these vaccines will significantly reduce that number. The World Health Organization was quoted calling this news a great step forward for women and girls. The lower prices were negotiated through the Gavi Alliance, a group created in 1999 with a grant from the Bill and Melinda Gates Foundation. The lower prices will start in Kenya, Ghana, Laos, and Madagascar, but will eventually spread to 30 million girls in 40 countries by 2020. And now for our tweet of the week. In reply to a May 10th Medical Economics article about unmoving high hypertension rates in the US, user Robert Bailey MD replied, "Here's a great area for lifestyle modification incorporated with sound medical care." Thanks for your feedback, Robert Bailey MD, and to be featured here, mention us on Twitter @Medeconomics. Thanks for watching Medical Economics Weekly. To get more episodes as they're released, please subscribe to our YouTube channel, follow us on Twitter @Medeconomics, or like us on Facebook at facebook.com/medicaleconomics. And send suggestions and feedback to bglenn@advancedstar.com or kstout@advancedstar.com. Thanks for watching, and we'll be back soon with more healthcare and practice management news. Don't miss it.